Okay, I know we're at the top of the hour for the event and that we are live. So we will get started in the next 5 minutes as people come onto the YouTube live stream and as we have more folks that are participating in the Zoom. So we appreciate your participation for the Facts on Vax. We will start shortly. Okay, I know we're at the top of the hour for the event and that we are live. All right, I see that we have people that are joining in live. So we are excited to have you. We're going to get started here shortly. Again, welcome to the Facts on Vax. We see a lot of people are starting to get into the YouTube live stream, so we are excited to have you. We will get started here shortly. Again, welcome to the Facts on. We see a lot of people are starting to get into the All right, well, good evening, everyone. Welcome to the Baltimore State of Vaccination event. My name is Gina Worthy. I'm the project manager for vaccine outreach for Baltimore Core. Along with my colleague, Natasha Murphy with Black Girl Votes, we will be co-moderating the event tonight. We really appreciate your participation. We see that there are a number of people that are on the live stream, so we're excited to have you as part of tonight's event. Our organizations are partners along with the Mayor's Office, the Health Department, and Rockefeller Foundation, as well as the Open Society Institute of Baltimore. We are all working together to provide Baltimore City with up-to-date and accurate information about COVID-19 and the vaccine. Tonight's event is one of a three-part series of virtual events that we will be hosting to ensure that Baltimore City residents are informed about new COVID vaccine data, facts, and resources that are available around the city. With that, we want this to be an interactive session tonight as much as we possibly can. So we're going to go through a segment called Did You Know? Some interesting facts that maybe you knew, maybe you didn't know around what's happening with COVID and the vaccine around Baltimore City. So within the chat box, we want you to put your answers, either a yes or a no, of if you knew this fact. So fact number one, that 60.9% of residents ages 18 and up in Baltimore City have been vaccinated. So they've either at least received one dose or a full dose of the J&J vaccine. So if you can, put in the chat box. Did you know that? Was it a yes? Was it a no? How informed do you feel like you are about what is going on with vaccination in Baltimore? So those numbers, those are good numbers, but we know that we have more improvement to make, but this is a good place that we're at. So I see that some answers are starting to come through. So, okay, good to see that you guys, there are some things that you definitely knew. You're staying up on facts within the city. So fact number two. So Baltimore City was chosen as one of 7 cities nationally to increase access to COVID-19 vaccines. We are thankful to, some of our partners, one of which is a huge partner, is the Rockefeller Foundation being part of the Equitable Vaccination Initiative. So Baltimore City was chosen as one of those cities to help with increasing access and equity among vaccination distribution and outreach. So yes or no, did you know that? Is that something that you knew, that you heard? Put in the chat box if you knew that, yes or no. We want to make sure and see, how informed we all are as residents. So that way, part of these events is that we are hoping to increase awareness as well as access to correct and accurate information. So I see some answers are starting to come through as well. So, all right, good job, you guys. So, okay, looks like most people weren't aware that Baltimore City was chosen. So this is really great. On a national level, Baltimore City is being recognized for the outreach that's taken place and the increase to access, which is absolutely the goal within the city and then across the nation. Good. All right, fact number three. All right, the Delta variant. So as much as we're doing good on kind of some other areas, the Delta variant of COVID-19 is increasing the number of new cases. Did you know that? Yes or no? So the new Delta variant that has starting to come through, we know we've seen some different, variations and variants of COVID-19. The Delta variant is one of those that has been moving a little bit faster. So did you know that the Delta variant is starting to increase the number of new cases, which means that we want people to continue to stay safe. So we know CDC has guidelines and we want to adhere to those guidelines, as well as just continuing to practice social distancing and being safe. So did you know Delta variant? Okay, I see some people are aware of it, which hopefully everybody is staying safe. Good deal. Okay, well, good. I appreciate you guys, your answers, please keep putting in the chat box because we still want to make sure that we know what you are aware of. So that way then in future events that we are able to tailor information to make sure that we are providing relevant and accurate information based upon what you want to know, which is the most important thing for us in these series of events. With that being said, I'm going to hand off to my co-moderator, Natasha Murphy, who's going to introduce Baltimore City's mayor.
Great. Thanks so much, Gina. And again, good evening, everyone. Thank you for joining us. We are incredibly thrilled to have you all on the line with us this evening as we continue to ensure that the vaccine rollout in Baltimore City is equitable for all of our residents. So again, my name is Natasha Murphy. I have the pleasure of serving as the Chief of Staff for Black Girls Vote, and as a nonpartisan, nonprofit organization that's focused on civic engagement. We're so happy to be leveraging our stakeholder and community empowerment skills for a different type of GOTV, and that's getting out the vaccination. So it is my pleasure to introduce the 52nd mayor of Baltimore City, Mr. Brandon Scott. As a lifelong city resident and public servant, Mayor Scott is committed to ensuring that the public's trust in city government is restored and ensuring that all city agencies are operating through a lens of equity. And it's his leadership and decisions over the past 16 months of the COVID-19 pandemic that have really showcased his commitment to those values and principles. So again, thank you for joining us, Mayor Scott, and feel free to take it away.
Thank you. Thank you, Natasha. And it is a pleasure to be here with a Black Girls Vote and all of our partners for this most important conversation. I would also like to say, I know they're coming behind me, that it's a pleasure to be here with Dr. D, our wonderful health commissioner, Dr. Scott Nolan of Addiction and Health Equity for OSI Baltimore, Vice President Otis Rowell of Us Equity and Economic Opportunity for the Rockefeller Foundation, Felicia Gross-Bellamy, COVAX Outreach Program Manager for Civic Works, of course, Black Girls Vote, Baltimore Core, and most importantly, everyone has decided to come to this important event. We all know that COVID-19 has been hard on all of us and has changed all of our lives forever. Over the last year and a half, it has held us back from work, school, family, friends, and everything we like to do. And we know we're still not out of the woods yet. But as we begin to pick up where we left off with normal life before the pandemic, we know that it is still here wreaking havoc on folks who are unvaccinated. 100% of COVID deaths in our state of Maryland last month were people who were not vaccinated. I'll say that again, 100% of people dying from COVID-19 right now in our state are unvaccinated. That tells us something, that we have the power in our hands, and now we have the accessibility in our hands to end COVID-19 and save lives. As this Delta variant of COVID is spreading through the United States, it remains more important now than ever that people get vaccinated if you have not been, as this disease is more transmissible than the normal strain of COVID-19, and we know it's more deadly even for younger people. The good news, the danger of these variants is severely reduced with vaccination, with doses of the 2 doses of vaccinations being 88% effective against the variant. Whatever concerns you have, and we know there are legitimate concerns about getting vaccinated. This is why the Health Commission and myself, all of our partners have been focused on education, focused on vaccine equity, to make sure that we're not just pushing people's legitimate concerns, especially when you're talking about Black and other represented neighborhoods that are legitimate based on what is happening in this country across the world with us and the medical industry. But that we hear those concerns, but we also use credible voices, credible messengers, people in our community that we can trust to show folks that this is a safe thing to get, and it's also the right thing to do. Whatever vaccine concerns you have, we encourage you to get that education that you need. We will provide that opportunity to you, and seriously consider the risk of not being vaccinated. Think about all the folks that we have lost in the city. Think about the families that are now struggling with the loss of someone who was literally the rock of their neighborhood, their grandmother, their mother, their father, who are now gone because of this most deadly virus. And likewise, I really encourage everyone to get vaccinated, their children, 12 and older, as soon as they can, to also reduce the chance that the severe illnesses in our pediatric population. We all know that we are also working to get our young people back in school so that they can learn in a traditional fashion while we try to get them back onto par where they need to be and breaking down so many of those barriers that were already there. We have a great informative program lined up for you tonight with our partners. But for the sake of your loved ones, your neighbors, everyone that you call a friend, for your city, for your state, for your country, for the world, please get vaccinated if you haven't. Make sure that all your friends are doing the same. Challenge people when they are spreading misinformation, because this is literally a matter of life and death, and we have to take it seriously. I hope that you all leave this forum well informed and ready to help us spread the information about the truth about the vaccination and why it's so important as we continue to fight a COVID-19, hopefully bringing it to an end. Thank you so much. I will stick around to hear some of the conversation, but always know that we're here to support, especially great organizations like the ones that brought us here tonight.
Thank you so much, Mayor Scott. Really appreciate your welcoming and opening remarks. And now I have the pleasure of introducing Mr. Otis Rowell III. Otis is incredibly important to Team Black Girls Vote because he is the person who first engaged us in the Equitable Vaccination Initiative, recognizing that there was an opportunity to engage with some of the trusted voices who may not always operate in the public health or medical space, but can serve as powerful community advocates. So again, Otis is Senior Vice President of the Rockefeller Foundation's U.S. Equity and Economic Opportunity Initiative. And today he'll be sharing a little bit more about the Rockefeller Foundation's decision to help advance vaccine equity nationwide. And as Gina mentioned, why Baltimore was one of a few select cities that were chosen. Otis?
Good evening. I am having some technical difficulties with my camera, but I am so excited to be here today, and I want to just thank Gina and Natasha, Black Girls Vote, OSI Baltimore, the Baltimore Health Department, and Mayor Scott, Dr. D. I'm really excited to be here today and to be part of today's conversation. The Rockefeller Foundation made a decision very early on that when and how we were going to be involved in supporting the vaccination effort had to be in and around equity. I have the privilege of leading the U.S. Equity and Economic Opportunity Initiative at the foundation. And in this COVID-19 crisis, we determined that we wanted to spend our dollars really focusing in on supply, access, uptake, and data. Recognizing that there will be challenges around supply, where we could be powerfully connecting communities to the supply, or around access. Existing mass infrastructure sometimes fails to bring vaccines to communities, and so we wanted to try to deal with that with a hyper-local approach to the work. On uptake, where and how we could improve the information that people need to make informed decisions. And finally, around data, making sure that we had the right data. When we first started this work, only 16 states were collecting race data. Now 48 states are collecting race data. So we made a $20 million commitment. Short term, we wanted to reduce racial disparity in vaccine rollout, try to get it down to zero. And in the long term, we wanted to strengthen the U.S. public health systems to achieve more equitable public health outcomes. I am so excited about our partnership with the city of Baltimore, with Black Girls Vote, with OSI Baltimore, with all of the partners who are coming to really address all of these various issues. We are trying to make sure that the millions of dollars that are being allocated from the Rockefeller Foundation and from others really go towards a hyper-local approach. While we have committed to a number of cities, a limited number of cities, Baltimore being one, we're also doing national work to really try to inform a conversation that makes sure that we are getting dollars to the communities at the level where they can make decisions. Vaccine delivery, vaccine information has to be done at a whole hyper-local approach, and we believe in the long term, we will strengthen the U.S. public health system if we have a hyper-local approach in dealing with both pandemics and endemics in Baltimore, in Maryland, in this great nation, all in all. So I'm excited to have had the opportunity to be a part of today. I'm so sorry, I'm not sure what's going on with my camera was working during our practice, but you don't need to see me. What you need to do is to make sure you're vaccinated, make sure you're telling your mom, your dad, sister, and brother, anyone who has an ear that vaccines work, that they are safe, and that is the right thing to do, not just for themselves, but for their community. So thank you for the opportunity to speak. And the Rockefeller Foundation continues to be committed to the city of Baltimore and to equitable vaccine efforts around the country. Thanks so much. Janine? Oh, Gina, excuse me.
Yeah, that's okay. Thanks, Otis. This work is very important, and the work of Otis and his team at the Rockefeller Foundation has been paramount. I get the pleasure to introduce Dr. Scott Nolan, who is the Director of Addiction and Health Equity Program at the Open Society Institute of Baltimore. Scott has really led some amazing projects focused around driving both local and national discussions on health disparities, particularly within communities of color. His work with OSI Baltimore on this current project is really paramount work in terms of moving forth the necessary outreach and work that needs to happen in Baltimore City with regards to just continued proper and accurate messaging for the vaccination efforts. So his engagement and impact throughout Baltimore City and what's happening in the city, he'll discuss a little bit further. So Scott? I'm not sure if you're on mute, Scott.
I am here. Can you hear me?
Yes, we can.
Wonderful. I'm not sure if my video started or not, but I have a few things I'd love to share with you all about sort of the amazing work that's been happening over the last 18 months as we've been in partnership with a number of organizations around COVID response. Going back to last year, actually, we had a whole lot of things planned within our foundation to do that. COVID made it very, very clear that those things weren't going to happen, that we weren't going to be able to move in those spaces and do those things. And so we actually, much like the Rockefeller Foundation, we cleaned the slate and moved in a different direction where we did some rapid response RFP grants where we were funding organizations that were trying to respond to COVID in terms of recognizing the impact that people being incarcerated would have in terms of that just being a really tough situation in terms of being able to keep people separated, being able to keep cleanliness and hygiene in those spaces. And so we knew those folks were going to be at risk. We knew folks living in congregate spaces were going to be at risk. And so we started well before the partnership with the Rockefeller Foundation, sort of thinking through how can we be in the spaces where people are at the most risk of negative outcomes in terms of contracting COVID, but also in terms of poor health outcomes if they did, in fact, get COVID. And so when the Rockefeller Foundation came along in early 2021 and said, you know, we'd like to partner with you on an equitable vaccination project, it was a no-brainer for us to get involved and get engaged with this. And I think one of the things that the Rockefeller Foundation initially told us was that they were very interested in essential workers, particularly people of color who were essential workers who were not able to do what I'm doing, which is working from home, and were going to be at risk because they had to be in person at their jobs. And so we said that makes sense to us in a city like Baltimore. Let's work on how can we make certain that there's good vaccination-related information and education available to people who are essential workers. But then we said, let's add to that. And let's look at other folks, other communities that may find themselves on the outs when you start to talk about equity, because there's lots of communities that get forgotten when we talk about equity. And so for us, that included people who use drugs. That included people who may be engaging in sex work. That included people who may be experiencing unstable housing or homelessness. And so as we thought about the project, which we titled the Baltimore Equitable Vaccination Initiative, we wanted to encompass a strategic plan that engaged all of those various communities to make certain that we weren't leaving communities out in our equitable vaccination efforts. And so our plan has really 4 main elements to it, and I'll just quickly list those out. The first element is culturally competent communications and public education campaign because we understood from the very beginning that there were going to be communities that have been historically mistreated by the health community, by health institutions, and that there was going to be some resistance to this vaccination. We recognize that in 2020, we didn't have the best leadership at the national level to instill confidence in communities as the vaccination was being created. And we wanted to be able to be in partnership with community-based organizations that could help folks understand exactly how the vaccinations were created so that we can have more confidence that they were safe and that they would be effective. And so that was kind of part one. The second part was we wanted to catalyze efforts to make sure that vaccine distribution and uptake was available for people in some of these disconnected communities that I've mentioned before, because we recognized that there was a high likelihood that the health disparities that already existed were going to drive disparities in access to vaccines. And we saw that early on in the efforts in terms of the way mass vaccination sites were set up in the state. One of the mass vaccination sites was in PG County. One of the first couple was in PG County at the Six Flags. And I've taken my children to that Six Flags many times, but if you don't have a car, you're not getting to that Six Flags very easily. And so we recognized that that was going to create some uptake issues for people who maybe wanted to get vaccinated but just couldn't get there. And even within Baltimore, with the mass vaccination sites downtown, we recognize that for many people in the city, again, if you don't have your own mode of transportation, getting downtown can be an ordeal. It could be an hour and a half ride each way for folks. And so we wanted to push from the very beginning on how can we get the vaccines into communities and connect with trusted organizations and communities that could say, you know, we want to host a vaccine distribution site, because we knew that that would allow people to have that trust, right? If that organization where I go to get my, when I do engage in the food distribution, or when I go to get workforce development training, those are places that I know are invested in my well-being because they have been even before COVID. And so having vaccination sites in those spaces we knew was going to be critical. And then the third element, just to move along, was that we really wanted to have this based in community-based public health. And what that meant was that we recognized when COVID hit, that community-based organizations became really, really critical in terms of getting information to people, in terms of helping people who lost their jobs or who had other health issues, who weren't able to get to treatment, but needed support, mutual aid and other things. And so we wanted to be able to build that out. And we had the conversation with the Rockefeller Foundation from the very beginning, where we said, you know, look, we're not going to go to people and say, hey, come get vaccinated. Oh, you don't want to get vaccinated? Okay, we got to move on because we got to meet our vaccination numbers. We wanted to have a whole health conversation with community members, and that has been very much supported by the partners that we've talked to, who said, look, folks in our community are like, why are you worried about us now? Like, why are you coming around now? Because you want us to get vaccinated. And we wanted to be able to partner with organizations that would be able to say, no, we care about everything that's going on with you. We want to be able to help you meet all the needs that you have and get you connected with organizations and agencies that can do that. And so that's a really critical part of the project is being able to do that. And then the fourth part is just a part of who we are as OSI Baltimore, the policy advocacy side, that as we see what's going on here, that we have the ability to partner with other organizations to lift our voice, to help community members lift their voices, to say, look, this is what's driving this inequity. And one of the main things we've seen is that our public health infrastructure is fragile. It's underfunded. I commend the health department on the work that they've done, but we can see very, very clearly that they're understaffed. They need more funding to not just only to be able to prevent future pandemics, but to be able to do the regular work that they need to do around asthma so that children can make it to school, or diabetes or heart disease. And so really that's going to be a huge part of the way Open Society Institute Baltimore moves forward, is talking about how do we prevent the next pandemic it's by investing in our public health infrastructure. And so we look forward to being able to partner with other organizations around the city and around the region in the state to push for more funding for public health infrastructure. And then in terms of, just thinking about a couple of challenges and opportunities that we've seen in the last 6 months as we've been rolling this project out, one of the things that's really been wonderful for me is to see how many organizations have stepped up across the city and said, look, we want to do outreach. We want to host a mobile site. And one of the things that really has become critical is how do we organize all of that? And so as a part of this project, we're really thinking about how do we make it so that folks can know what are the mobile sites in the community, and that we don't have mobile sites necessarily right across the street from each other if that's not necessary, so that we can use the resources that we have in the best way possible to get the most people the information that they need to make the decision, and then hopefully ultimately vaccinated. But again, if people make the decision that I'm not ready to get vaccinated, the way we're thinking about this project is, okay, so what else do you need? Let's talk about what's your COVID safety plan? How can we move forward to help you with your other needs? And so that's been a really, really critical part of the conversations that we've had. And as we've talked to faith leaders and other leaders within communities, that's been really big. Folks saying, let's talk about this much broader, in a much broader lens than just COVID-19 or just getting people vaccinated. And so, with that, I think I'll end my remarks, but I've just been really impressed with the way folks around Baltimore City, individual community leaders and organizations have stepped up to this challenge. And we look forward to continuing and move that needle on that 60% of folks that have been vaccinated, because we know in that 40% that have not been vaccinated, there's a lot of people of color and other groups of folks who are disconnected in various ways from healthcare. So with that, I'll turn it back to Gina.
Thanks, Scott. So next up, Natasha is going to introduce our health commissioner. Natasha?
Great. Thanks, Gina. And Scott, as you and Otis mentioned, it's really been the power of us as a collective, moving forward and collaborating to amplify the work of our healthcare and public health officials and professionals that have made all the difference. And so with that in mind, I would like to welcome Baltimore City's Health Department, our Health Commissioner, the incredible Dr. Leticia DeRaza. Dr. DeRaza is a pediatrician by training, but she is also incredibly committed to equity and the social determinants of health. And so she will be bringing us a presentation this evening that is going to give us the latest facts and figures as it relates to the progress of vaccination within the city limits. Dr. DeRaza?
Great. Thank you so much, Natasha, for that introduction. I echo what both you and Dr. Nolan mentioned. None of this work is done in a vacuum. All of the successes that we've seen with vaccination rates are as a result of a collective and collaborative effort. So I thank Black Girls Vote for sponsoring such a wonderful event and providing me with this opportunity to share some updates. I also want to thank our partners this evening. So OSI, Baltimore Core, and the Rockefeller Foundation. Really having partners in this space exponentially increases our ability as a city to get the work done and to reach our community more effectively. And then lastly, but not least, I want to thank Mayor Scott for his leadership really throughout the pandemic and his general support. He has been on the front lines, sharing the message on the importance of vaccination, and he continues to push that message. And I just really appreciate his support throughout all of this. So if you can go to the next slide. Very quickly, our agenda will include a COVID data update. That'll include our COVID-19 metrics, our vaccine data review. And then lastly, we'll talk a little bit about the equitable vaccination strategy being taken on by the city and our partners. Next slide. So starting with our epidemic curve, and I will start by saying all of this information can be found on our website, coronavirus.baltimorecity.gov. And all of this information is up to date as of yesterday evening. So we do update our dashboard daily as the data is coming in. So you might see a slightly different number if you go on there today. We are currently averaging just a little under 7 new cases a day. And this is down significantly from where we were a month and certainly 2 months ago. And I certainly know that that is as a result of our vaccination rates here in the city. Next slide. Looking at our percent positivity, again, well below 1% at 0.3%. And this is down 55% from where we were just a month ago. Next slide. When we look at hospitalizations over time, again, this is striking, right? We see that there were a couple of peaks early in the pandemic. We saw this spike in hospitalizations. We saw a similar one in the summer, and then again in the winter going into the spring. And as a result of vaccination, we have seen this number come down significantly. So that as of yesterday, there were only 45 patients hospitalized in Baltimore City with COVID. Next slide. For reference, and we didn't show the number, but at our peak, we had 400 plus patients in the city hospitalized with COVID. When we look at deaths over time, similarly, we're seeing a significant decline. We've had multiple days in the past week where there were no deaths reported. Again, all as a result of the vaccinations. Next slide. So one thing that we do note, and I do get asked this question, we're seeing positivity improve, we're seeing cases go down. What about our testing volume? So we have certainly seen the testing volume come down. So I do want to take the opportunity just to encourage people to still get tested, right? So certainly, especially our unvaccinated folks, if you're experiencing any symptoms that could be slightly similar to COVID, right? Cough, runny nose, headache, fatigue, get tested, right? It's still extremely important, maybe more so important to really identify individuals that might have COVID-19 and very quickly isolate them from others so that others don't fall ill. So we have seen our testing volume come down, but we're still averaging above 2,000 tests per day. Next slide. So shifting gears a bit to provide some overview about where we are in terms of vaccinations here as a city. Next slide. So again, and this data is from yesterday, I think they posted the updated data from today. We have almost 61% of adults 18 and over with a first or a single dose of vaccine. And when we look at who's been fully vaccinated, and we're looking at people above the age of 12, we're almost at 55% of city residents that are fully vaccinated. Additionally, looking at our 60 and over population, almost 74% of them have received a first or a single dose. So our older adults are leading the pack in terms of vaccination rates. And some of that is certainly that they were eligible a bit earlier on. And so now we're getting into pediatric vaccinations and how to ensure that our 12 to 18-year-olds have the same access and opportunities that many of our older adults had early on. But again, I'm really proud of the work that we've done, the work that our partners have done to increase these numbers. Next slide. So additionally, on our dashboard, you can actually identify vaccination rates by zip code. And so this data is very important to us, and I know our partners use this data as well, because this is what helps to drive our mobile vaccination efforts. So a lot of what we've done in the past few months is really shift from having that mass vaccination site to now having mobile vaccine teams and having kind of these temporary locations that are in places with low vaccination rates. So this data that we're sharing is the same data that we're looking at as we're making decisions on where to send those mobile response teams to set up and begin providing vaccinations. So again, the darker purple on this represents the highest vaccination rates per zip code, while the lighter purple indicates a lower vaccination rate. And so you can see where we have our lower vaccination rates typically on the east side and west side and some parts of the south part of the city. Next slide. So another thing that's important to note, and again, this information can be found on our dashboard. I know these numbers are a little harder to see, but we have broken down by race the percentage and the number of individuals who have been vaccinated. So I know it's slightly hard to see on here, but the first two bar graphs represent the total number of all Black residents in Baltimore City that have been vaccinated. So a little over 140,000 Black residents have received a first or a single dose, compared to 103,000 white residents that have received a first or a single dose. Next slide. Looking at gender, we do see where the rate of vaccination in women is outpacing the rate of vaccination in men. This is not uncommon. This is what we generally see with vaccinations. Women are generally more likely to seek healthcare. Next slide. And then this graph represents the percentage of residents vaccinated by ethnicity. So when we look at our Hispanic population versus our non-Hispanic population, they actually have higher vaccination rates compared to the rest of the population. So almost 54% of Hispanics have received a first or a single dose, compared to just 46% of the remainder of the population. Next slide. So this represents the cumulative number of vaccines administered per week through our mobile response teams. And I specify that because there's many other vaccination efforts occurring across the city. This is just specific to the efforts that we are supporting alongside clinical partners. And as you can see, there has been a leveling off in recent weeks, which is not dissimilar from the trends that we're seeing across the country. But we continue to go out and provide both first and second doses through those mobile response teams. Next slide. So the previous slide represented the cumulative. This represents the number each week. The last week having incomplete data, but you can see again, as I mentioned, that we are seeing an overall decrease in the volume of vaccines being administered over time, which again is not unusual when we look across the country and what's happening with vaccination rates. So though we're seeing this decreased trend, one thing I am really proud of is that we do still continue to see people get vaccinated, new people get vaccinated every day. So we know that there's still a lot of work to be done, and there's still interest, right? We know that now we're kind of shifting, and I'll talk about this in our goals, we're shifting to more of our ground game. So again, it's less about having the mass vaccination site that might service a couple hundred or thousand per day, and really how do we go into the community and engage people where they are? And to be clear, we did that from the beginning, right? We started our mobile response teams in senior housing sites. So even in January, we were going to senior housing sites and made that our initial priority to really meet people where they are and provide them with vaccine within their residence. Next slide. So thinking through what our overarching strategic goals are when we begin to plan for vaccination. So we want to, by February of 2022, equitably vaccinate 80% of our city residents. We also are working to reduce COVID-19 vaccine hesitancy or deliberation among city residents, but we have a particular focus on communities that we know have been disproportionately impacted by COVID-19. We also set an initial goal of by March of this year, having a robust data management and monitoring system. So much of the graphs that I showed you are pulled directly from that dashboard, similar to when we developed our first dashboard that provided COVID-19 metrics around cases and hospitalizations. We knew that it would be extremely important to be transparent with where we were as a city in terms of vaccination. Next slide. So I began to mention this, right? There are lots of challenges, but also lots of opportunities as we strive to reach towards this goal of 80%. Demand for the vaccine is slowing down. Again, we're seeing that everywhere across the country. Vaccine is now much more widely available than it's ever been, yet there are still some who remain unvaccinated. So we've really began to shift our strategy and put more emphasis on that ground game. In June, we transitioned much of the work we were doing on our mass vaccination site and started to focus even harder on our mobile response teams that are, again, going out into the community. This work, again, is supported by clinical partners, many of our hospitals, schools of nursing, schools of pharmacy, and also the Mayor's Office of Neighborhoods, who's helping with canvassing of alongside community partners ahead of our events. We recognize that canvassing, that providing of education and doing that initial outreach is extremely important before any of our events. Next slide. We also recognize that access is extremely important, right? So certainly we want to make sure that people have the education, but then do they have the access? Do they know where to go to get vaccinated? Again, the health department is one of many clinical partners providing vaccinations. Many of our local pharmacies, our community health centers, our federally qualified health centers, our hospitals are also providing vaccinations. Some people may feel more comfortable going to their primary care provider. So likewise, there are primary care providers who are providing vaccinations. We do provide a weekly schedule that we push out on our website of the vaccination events taking place. We indicate on that schedule what vaccine will be provided. We remind people that the vaccine is free. So please don't let cost be a factor. We've also transitioned to provide even more after hours and weekend hours so that individuals can go after work or during the weekend. If you need support or assistance, you can call our call center, which is also open on the weekends, to schedule an appointment at 443-984-8650. And then lastly, we provide transportation to and from vaccine appointments. It doesn't have to be one of our clinical sites. As long as it's a vaccine appointment, we're able to support with providing transportation. So for that, you can call 410-372-3444. Additionally, not on this slide, we're supporting homebound vaccination efforts. So we recognize that many residents are homebound. And their caregivers must stay with them in the home. And so we provide vaccines to individuals that are homebound as well. Next slide. So in order to tackle what we knew would be some of our populations that were most heavily impacted, we established something called value communities, which stands for Vaccine Acceptance and Access Lives in Unity, Education, and Engagement. And essentially this initiative is focused on engaging, educating, and mobilizing, again, communities that have been hardest hit or most impacted by COVID. This is done in partnership with MICA, Morgan State, and IVAC, or the International Vaccine Access Center at Hopkins. We've held a number of listening sessions specific to these groups and have co-created and co-led with vaccine communities representatives who become peer ambassadors. So I think, it was Otis who mentioned earlier that it's extremely important that people hear the message and the importance of vaccines, not necessarily just from the government entity, but from their peers. And so we've been able to engage many peers, again, within the community to be that trusted voice and to be that trusted messenger about how important it is to get vaccinated, and then to subsequently direct them to neighborhood vaccination sites that we've set up. Next slide. In addition, we develop neighborhood canvassing toolkits. So this is what our value communities are using, again, to go out into the community, to be that messenger, to provide education, to perform outreach, and to answer any questions that people might have that they encounter. And so that is something that is widely available that we're sharing with partners. Next slide. Additionally, this is something else that we've developed. So again, based on our focus groups, based on working with the value communities, developing information that addresses the myths and concerns around hesitancy or vaccine deliberation head on. So how do we directly answer what we know is a challenge? And how do we also make the process easier? So we've included how you can book an appointment. We provided links to the information that we've developed, again, that can be disseminated amongst community-based organizations, or amongst neighborhood associations. Next slide. And then again, your voice is important, right? So everyone on this call, your voice is extremely important. Again, in some ways, maybe more so important even in the health department, because you have influence on your friends and your family, and so they may be coming to you. So we do have toolkits, as I mentioned, available. You can reshare much of what we're posting on social media to sort your social media account, again, to grab the attention and the focus of your family and friends who may still be deliberating on whether or not to get a vaccine. Next slide. In addition, I just want to talk very quickly about our work around pediatric vaccinations. So in May of this year, children above the age of 12 became eligible for the Pfizer vaccine. So we have been working with city schools very closely to hold vaccination events at 9 schools dispersed across the city geographically throughout the summer. During those events, we also provide parents with exit surveys. So we want to understand, for those parents that did come and get their child vaccinated, what was their experience? What inspired them to get vaccinated? Additionally, we're hiring peer ambassadors for this value community as well. So recognizing how important it is for our pediatric population, especially our adolescents, to hear from their peers on the importance of getting vaccinated. We'll continue to work with city schools and other agencies that are hosting and sponsoring youth-focused events to provide vaccinations while there. In addition to holding pediatric-focused listening sessions, so hearing directly from our young people about their questions, and then again, designing the material that speaks directly to them. Next slide. And then lastly, so I mentioned in the beginning, none of this work is done in a vacuum. We cannot do this work without our clinical partners, without our community partners. And as such, we have worked with CivicWorks to develop a microgrant program. So for those community-based organizations that are interested in supporting, whether it's through outreach, education, hosting a vaccination clinic, doing some type of neighborhood canvassing, we want to provide you all with some additional support in the form of microgrants so that you can help the mission. And so again, I want to thank our partners again who've made this possible, OSI, Rockefeller, Baltimore Core, CivicWorks, who've really helped to support this microgrant effort. And with that, I will close.
Great. Thank you for that fantastic information. As you all know, we aim to continue to provide accurate and informed information. So thank you, Health Commissioner. That was absolutely amazing. Next up will be Nigel Garcia, who will introduce Fagan Harris. Nigel?
Hello, everybody. At the start of the pandemic, we faced uncertain times filled with fear, misinformation, a lack of basic resources, and unemployment. But something remarkable happened. We saw as everyday citizens, civic leaders, elected officials, neighbors, nonprofit leaders stepped up and worked in collaboration. They showed us and led with empathy and compassion as they embodied the true spirit of servant leadership. We want to highlight some of those individuals and organizations today. And to start that off, I want to introduce Baltimore Core's founder and CEO, Fagan Harris, someone who I've had the pleasure of working with for the past couple of years. Thank you.
Hi, Baltimore. My name is Fagan Harris. I'm the president and CEO of Baltimore Core. 16 months ago, I tested positive for COVID-19. It was right at the very beginning of the pandemic, and it was one of the scariest moments in my entire life. I could barely breathe. Every breath I took was shallow, and it felt like I was inhaling shards of glass. At home, in bed, I was sleeping 16, 17, 18 hours a day. I lost nearly 20 pounds. I could barely walk. My body just wasn't getting enough oxygen. Thankfully, I recovered. And in the months since, our organization, Baltimore Core, and so many Baltimore Heroes have worked our hearts out to fight back against COVID-19, to ensure equitable access to testing, to ensure equitable access to the vaccine, so we can see our friends and our family without fearing for our lives. We have a really difficult relationship with the medical system in communities of color. And no public health campaign is going to erase that. And so we have to be mindful of that in every interaction and in all we do. And we also have to look out for each other. And together, this coalition is helping to get the right information out there about our options and our healthcare. Baltimore Core is proud to stand with our Baltimore Heroes to fight back against COVID-19, to work with the mayor to guide this city through this unprecedented and difficult time. COVID-19 remains a serious, and deadly disease. There's not a day that doesn't go by that I'm reminded of its impacts on my body and in my life. I feel lucky to be here. I feel lucky to do the work. And I'm thankful that I had friends and family to help pull me through the other side. And I know that if we continue to work together, all of us will see the other side of this virus.
Baltimore Heroes, honoring just some of the many grassroots community-based organizations who faithfully serve the residents of Baltimore City before, during, and after the COVID pandemic.
My name is Anna Rodney, and I'm Executive Director of Mom Cares, and I am supremely humbled and grateful to be honored as a hero here today. As a Baltimore resident and parent, I shared in the fear and confusion that this pandemic brought, and it was important for me to activate not only as the Executive Director of Mom Cares, but as a citizen of Baltimore City. Through Mom Cares, we support Black women in particular who are navigating a high-risk pregnancy and or a NICU involvement after a poor birth outcome. In the face of the pandemic, we realized that we had to switch our scope from that very specific population and broaden it to Black mothers in general in Baltimore City. So we started to order diapers, wipes, formula, breastfeeding supplies to make sure that we were able to give those out to our community. We since have been able to support Baltimore City and some of Baltimore County while we have been navigating through the pandemic. We are now able to provide psychiatric rehabilitation services through our larger organization, the Rising Mama, but also through Mom Cares. So we'll be able to support our mothers who are possibly navigating postpartum depression, PTSD, and just the trauma of moving through this very difficult time. The thing that excites me about my work is the ability to be a mirror to the mothers that I work with. Mom Cares came out of a need that I saw as I was navigating the NICU with my son, to be able to come eye to eye and face to face with these mothers who have this shared journey and be an example of the fact that we are strong, we are resourceful, and we are surrounded by community. Being compassionate and caring and kind to someone who has just had a baby is not only sowing into them and their family unit, but will ultimately sow into the community.
I'm Antoine Quarles, founder and director of Hope Baltimore, helping oppressed people excel, which sustains opportunities for oppressed communities and gives individuals hope that there is a validation of self-worth and sustainability. During the pandemic, we went and bought canned tuna fish, hand sanitizer, peanut butter and jelly, cheese cracker packs, alloy juices, and waters. We went directly to the impacted community of Penn North to Upton Square. We went from serving bags to people to going for 29 weeks straight of 80 bags a week, anywhere from 2 o'clock in the afternoon to 4 p.m. in the afternoon every Saturday. So we served over a population of 3,500 people with food bags and masks at that time. It wasn't just a vaccine, it was registering people to vote. There was a lot of educational lectures that we was doing with different educational systems of schools, from Yale to Towson to Morgan to Coppin State. Some of my guys hit the ground with youth organizations and start doing cleanups and removing trash, start walking communities, giving out flyers, just to show what hope was really about. The community in general, we looked at as an impacted need that was there, to how we could give resources, how we could actually give food, how could we give a sense of hope, and also keep everybody safe and healthy. At Brown's Church, we had did on-the-spot testing. People were getting released from prison and not even being tested. You had family members that was home that wasn't tested. So we reached out and found out through our network to create a link and bonded with Emmanuel, St. Peter Claver, Brown's, CVS, and Safeway. We hit the ground running all across the city. That's the whole point about hope building legacies, hope changing lives, and hope building and reform communities and citizens. Somebody instilled hope in me, I still hope in another, and we continue to still hope in each other. With that, hope changes lives.
My name is Rachel Brooks, and I'm the lead organizer with BUILD, Baltimoreans United in Leadership Development. BUILD is the city's oldest and largest citizens' power organization, and we work every day to find and develop new leaders across our city for the transformation, the revolution, and the revitalization of the Baltimore that we all deserve.
I'm Bishop Bruce Lee Wendowski. I'm the pastor of Sacred Heart of Jesus and St. Patrick's Catholic Parishes. I am also a leader in BUILD and a member of the BUILD strategy team. Thanks so much for recognizing us and the hard work we've done.
We found ourselves in the middle of the beginning of a pandemic. BUILD leaders across the city rose to the occasion. They got on the ground, on the phone, and started calling hundreds of people to figure out How are we going to take care of our own? We had to organize our relationships through the hospital networks, through the mayor's office, and through the state to be able to generate consistent food access and delivery. What we thought was going to be a smaller group of folks went from 125 people up to 5,000 people that we have been feeding since the beginning of the pandemic. So we found over 40 people who had either lost wages or had lost their jobs entirely, and they became the backbone of our delivery system.
They became the primary source of information for a lot of the members of our church and in the Latino community at large.
The result of that access to people meant that we were able to apply pressure or work with the state or work with great partners in the city to be able to open up the mass vaccination site with University of Maryland downtown.
With Build and with strong partners like Johns Hopkins, Savo Foods, the alternative now has become the norm for many of folks in our community. It started all with a box of food, and then delivering that box of food to the door became delivering testing, delivering vaccine, delivering financial help and assistance.
What we've done through this pandemic over the last 15 months is the work of hundreds of ordinary people who stepped up to the plate to save themselves. The leaders on the ground in your neighborhoods, thank you for the lives that you have saved.
So thank you so much. It's, really incredible. And we thought it was pivotally important to make sure that we were recognizing those who have done such impactful work over the last 16 months. But as we wrap up today's conversation, I wanted to highlight some upcoming events and resources. So as a part of the larger Baltimore Equitable Vaccination Initiative, we are launching our COVID vaccine resource website, which is at the link displayed here, bemorevax.org. It's coming soon, but we'd encourage you all to make sure that you stay abreast of the latest and greatest on that site. As Gina mentioned, this is a part of a larger 3-part series where we'll be discussing other aspects of how COVID-19 has impacted our lives from the social perspective to the community perspective. So be on the lookout for additional events. Furthermore, we want to make sure that we are engaging and soliciting input from the very people that we hope to educate and serve. So if you have any ideas for swag, those physical tchotchkes that you would like to see that are Be More Vax branded, coming from the Baltimore Equitable Vaccination Initiative, please feel free to drop your ideas and suggestions in the chat. And then finally, as multiple of our panelists and speakers mentioned, there are funding resources available for those organizations and individuals who will continue to do this incredibly important work. And so to learn more about the Civic Works MicroGrants, we have the Civic Works website listed below. And if you have any questions, you can also reach out to Scott Nolan at OSI. And so with that, thank you so much for joining, and I'll turn it over to Gina.
Thanks, Natasha. As we close out tonight's event, we really want to thank our panelists, Mayor Scott, the Health Commissioner, the Rockefeller Foundation, OSI Baltimore. We really and truly appreciate, one, your commitment to the health and the equitable access and distribution of the COVID vaccine for Baltimore City residents. We truly want to thank you all as Baltimore City residents for your active participation in tonight's Baltimore State of the Vaccination event. As Natasha mentioned, this is one of a 3-part series. So we look forward to your participation in those future events, because ultimately we aim to continue to ensure access to COVID vaccine facts as well as resources, and to continue to inform the residents of Baltimore City around how to access that information. So with that being said, continue to stay safe and healthy.